2022 in the House of Commons, and that our Parliament is going to take a break for the holidays without ensuring that legislation becomes law.
This is the Canada Disability Support Benefit.
Yeah, the Canada Disability Benefit, Bill C-22, is in the House. It hasn't even made its way to the Senate yet. We were pushing for its passage within this year. That C-22 passes in 2022. That's certainly not going to happen. And it's on the table. We wish that it would pass in Parliament, third reading, and be referred to the Senate so that it can eventually become law in early 2023, and hopefully budget it so that people with disabilities actually get the benefit in 2023.
Part of this is also the conversation around MAID itself, which is a very complicated and nuanced discussion in this country, and one that is, as Jackie said, evolving into the new year as well. Those who support medical assistance in dying will say that there are safeguards in place, that for cases that are terminal, there is that 90-day waiting period after approval, that one of the people who's doing the assessment has to be a specialist in the condition of the patient. Do those safeguards provide the barriers that you want to see, so that people don't feel as though this is a choice they have to make?
No, there's no safeguard against people compelled to choose medical assistance in dying. It's a very slippery slope. We are devaluing as a society. We're taking sort of a cheap option of out for our responsibilities toward people in our society that are vulnerable, that are disabled, that have medical conditions that need support to thrive.
This has been an issue that disability activists and disability rights organizations have spoken about since the debate around MAID began in this country. Yeah. And what you'll hear often on the other side is that issue of choice as well, that people will say that it allows some patients to regain a sense of control, that it allows patients to regain an element. We may not support that, we might not agree with that, but that it gives the patient some agency in where their life goes.
Matt, when people are living in poverty, it's no longer a choice. It's not a choice. They didn't choose to live in poverty. They're living in poverty. They're facing deeper and deeper poverty. Over 50% of people who are food insecure are people with disabilities. Over 41% of people experiencing poverty are disabled people. People with disabilities don't have choice.
Just to be clear, just the inadequate support, or somebody who doesn't have supportive housing or adequate housing, that doesn't help. That doesn't qualify them for MAID. But your point is that can be a contributing factor in steering somebody there.
It's just not giving them a choice, right? Like, we're giving them a choice to look at medical assistance in dying because of the exacerbated pain and symptoms that they may be feeling because of the barriers they experience to accessing healthy food and a reasonable quality of life. It's really, really a fine line. It's a slippery slope, Matt, where we're essentially saying, okay, we're not going to give you the supports you need to thrive, but here's an option for you. We're giving you choice. Is this really a choice?
As this debate unfolds, and having heard Jackie's story, but also the concerns that you've raised, what do you want us as a nation to be thinking about as the debate around MAID continues, and in this context of supporting people who are living with disabilities?
I want people to think about what they have in their lives. I want them to think about the holiday season and how they're going to be celebrating and gathering and gifting. I want them to think about all of that, and then think about what are we offering as a society to people with disabilities for them to live with basic dignity and respect in our society. What are we giving them? The option to line up at food banks, the option to choose medical assistance in dying. What are we giving them as an option this holiday season? We need to give them
Law and Policy at the University of Toronto, has been listening to our conversations. Trudeau Lemons, good morning to you.
Good morning. Thanks for organizing this difficult discussion.
Thanks for being part of it. You have argued that expansions to MAID are discriminatory against people living with disabilities. I guess briefly, what is the legal rationale behind that argument?
Well, if you look at who qualifies now outside of the broad end-of-life context for medical assistance in dying, it's exactly the type of people we've been talking about. It's people like Jackie who are suffering from a disability and have irreversible decline of capability. It's not a person without a disability, so people without a disability won't have access to MAID even when they live in poverty. People with disabilities disproportionately struggle with poverty and with intersecting components also of mental health struggles. And so it's towards those people that the state is now sending the message that death is an option for them, and that suicide prevention that we will continue to apply towards other people will not apply to them.
How does that compare to other nations around the world, particularly when it comes to disability and living with disability?
Well, we have to be very clear that there are very few countries that have actually legalized medical assistance in dying, particularly outside of the end-of-life context. And so the two countries that have had a practice for quite some time, since 2002, are Belgium and the Netherlands. Spain has legally had a decision as well by the Supreme Court, but most of the countries have legalized some form of physician-assisted suicide restricted to the end-of-life context, and so even more restrictive than the law that we had before. Several states in the US, for example, New Zealand, the state of Victoria in Australia, require a terminal illness diagnosis and a prediction of life left of 6 months. So there are not many